Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Romain Silhol and Oliver Stevens join me to speak about new UNAIDS estimates of HIV among key populations. Oliver, what is the role of the UNAIDS reference group?
The reference group is an open cohort of epidemiologists and statisticians and public health professionals who provide UNAIDS with technical advice for HIV model development. Particular focus of the reference group in recent years has been HIV estimates in key populations, particularly in sub-Saharan Africa. These key populations include female sex workers, men who have sex with men, and people who inject drugs, and transgender people who have not played such a core role in the HIV estimates process in the past, but we're looking to change that and increase the prominence of these key populations in the estimates.
Estimates for key populations, why is this so important?
Unlike HIV surveillance amongst the total population, surveillance is much rarer amongst these populations, and so it can be quite hard to know how to make policy and how to guide HIV programs. So what we've done is a large model comparison exercise, pulling together estimates from lots of models and lots of countries, and our latest estimates are that around 12% of new HIV infections occur in female sex workers and men who have sex with men, and that HIV incidence in female sex workers is 9 times higher than in women, and 40 times higher amongst the men who have sex with men than in all men. So it really highlights how high risk these populations are and how much more work needs to be done to serve their needs.
Roman, the modelling included estimates for partners of these key populations as well. Can you explain?
Yes, the HPTN Modelling Center joined forces with 8 other modelling groups to measure HIV acquisitions among partners of key populations, such as clients of female sex workers or female partners of men who have sex with men. We found that partners of key populations often acquired as many new HIV infections as key populations themselves.
And how can these estimates be used?
These results advocate for addressing prevention and treatment needs among the key populations which are particularly underserved, as this will be central to reducing inequities for key populations and accelerate the decline in HIV incidence among key populations themselves, but also other segments of the population.